The term hardening of the arteries tends to conjure up visions of blocked coronary arteries, those arteries in and around the heart. Peripheral arterial disease, or PAD, affects more than just the heart. It affects the extremities as well. American Health Journal spoke with Dr. Theodore Teruya at Redlands Community Hospital about the diagnosis and treatment of PAD.
PAD, or peripheral arterial disease, is basically blockages in the arteries that feed the legs, and that blockage is most commonly due to atherosclerotic disease, or what we know as hardening of the arteries. It tends to affect men more than women, and it does affect older people. And it's interesting because if you look at people who developed coronary artery disease or hardening of the arteries in the heart, they tend to usually present 10 years before people have severe disease in their legs. And so oftentimes the people we see have had stents placed in their heart or bypasses in their heart, and down the line as they get older in their 70s and 80s, they develop symptoms of peripheral arterial disease.
We asked Dr. Teruya to describe the symptoms of PAD.
As a vascular surgeon, most of the people I see with peripheral arterial disease have symptoms in their legs. And the symptoms can range anywhere from no symptoms at all to pain in their legs when they walk. And in the worst case, people can develop wounds in their legs that don't heal, or even gangrene of the feet. It's interesting because most people who have peripheral arterial disease or some degree of blockage in the legs don't have any symptoms at all. And for people who don't have symptoms, there's no real treatment necessary to treat the disease in the legs itself. But they do need to know that they're at risk, because if they have hardening of the arteries in the legs, they do have disease in the heart, which puts them at risk of developing a heart attack, or possibly in the arteries that feed the neck, which puts them at risk of having a stroke. The two biggest risk factors for peripheral arterial disease are smoking and diabetes. And other risk factors would be hypertension, high cholesterol, bad diet, limited exercise. Our goal is to save people's feet as much as we can. So what we do is we usually start with a diagnostic test to determine where the blockage is in the legs. And when we determine where the blockage is, we can sometimes treat it with minimally invasive techniques. Those would be things such as balloon angioplasty or placement of stents across those areas of blockage to open up the arteries and allow better circulation to the feet. If we're able to treat people, usually people do very well. So if their symptoms are what we call claudication, or pain in the legs when they walk, usually we can make them better. There are various different types of treatment for the mild stages of disease. We have certain medications which can improve their walking, or even procedures such as what I mentioned, angioplasty, stenting, or bypasses can improve their ability to walk. When people have more severe disease that results in wounds or gangrene, it oftentimes is more difficult to treat, but we can often treat those people, and 80–90% of the time we're able to save people's feet.